Hi, Rick Rowan, healthcare entrepreneur. In this episode, we're going to talk about microcurrent and fibromyalgia. Fibromyalgia represents a common musculoskeletal disorder. Fibromyalgia syndrome is a potentially disabling chronic pain condition, often resulting from injury, especially cervical spine trauma. This condition can cause pain that radiates well beyond the site of injury and affects the whole body, including the extremities. Some patients describe the pain as sharp, burning and stabbing, while others describe it as dull and diffused. Currently, there is no widely accepted effective treatment for the condition, and symptoms can persist for years even if various therapeutic approaches are implemented. Fibromyalgia is often managed with pharmacological treatments such as opioids and anti-inflammatory drugs. Microcurrent stimulation, or MCS, represents an electrotherapy modality characterised by microamperage treatment that emulates those generated naturally by the body's endogenous electrical system. It has been found that MCS is effective in improving pain and reducing inflammatory mediators associated with fibromyalgia. MCS is safe and almost side effects free and should be used as an adjunct or alternative to current therapeutic treatments.